It's our segment, but they're your questions, and it's time for Doc Talk. And we are joined today by Dr. Dina Tom, a pediatric specialist from University Health and UT Health San Antonio. And we're going to talk about a variety of things, but first, Myra has something she wants to show people.
A second special guest we must introduce. This is Luna. Have you seen these cardboard kids around town? It is part of Child Safe's campaign this month. April is National Child Abuse Awareness Month, and this is part of their effort to raise awareness of what's a really big problem here in San Antonio, something that I know that you see in your line of work. So how can something like this help us have really tough conversations with our kids, especially about prevention of this issue?
San Antonio has the highest rates of confirmed child abuse cases in any major city in Texas. So we have a problem in this city. And I think it's really important that we all know about it because we really all can help. This is Child Safe's public awareness campaign to make everyone aware, to ask questions about what child abuse is. So child abuse, obviously we hear about pretty horrific cases, right? Which in the broad spectrum of statistics is pretty rare. However, neglect is actually the most common type of child abuse. And when we talk about neglect, we talk about, a child who lives in, maybe doesn't get fed as often as they should, lives in conditions that aren't safe, doesn't go to school, isn't able to protect themselves. So those are things as a community that we can watch out for in our neighborhoods, in our schools. So obviously as a pediatrician, I see it in my practice, which is truly the hardest thing that a pediatrician sees.
This is clearly something where we do not want people to mind their own business when it comes to this.
No, we don't. You really can make a difference. If you see something that doesn't seem right, it is completely within and encouraged within your power to notify Child Protective Services or Family Services. And you can do so anonymously. You can have the minimum amount of information of knowing maybe a child's name or age or where this occurred or their address. You don't have to have all the details, and you don't have to say who you are. You can just make a cry for a child, and that's the most important thing because they may not have the voice or the strength to come forward.
Yeah. And what I love about this is an art project, it's something simple, and it's a way for, I'm thinking of my kids 4 and 6, like bringing up child abuse is it's not easy for them to even grasp, but if you're doing a project with your kids, decorating something, it's a good way to start a conversation about what's a safe touch, what's not, when you need to tell somebody when something's wrong. Is that how you start a conversation like that?
Yes, exactly. I think it's most important to keep it age appropriate. So starting those conversations with your children when they're really young, and also honoring when they tell you to stop something. So that's always hard. As a parent, I love to tickle my kids and I love to, mess with my kids, but always being mindful too that when they say stop or no, or I don't want that you listen, because it helps them to honor their own bodies and realize that they do have that autonomy to protect themselves. One of the things I love about these cardboard kids, Luna, is that she's individual. She's made exactly how you made her, and maybe your family, and that's how every child with child abuse is. They're all unique, and it really helps us to raise awareness that there's lots of different types of abuse.
Yeah, for sure.
All right, let's get to some of our questions. First from our viewers, we're going to start with one about allergies. How can you tell if symptoms are allergies or something else? Can you combine certain allergy meds for kids, or should you stick with only one?
I have been faced with this, like many parents, in the morning.
Yes.
Before school, and you're like, it's allergies, and you're hoping it's allergies. But really, allergies really don't have this kind of like robust peak in like a cold does. So we know that a cold is usually from a virus, and it lasts about 5 to 7 days. Allergies typically are a little bit more indolent, which means they come and go. Child might feel worse in the morning, and then as the day goes on, they feel better. And yes, it is safe to give some allergy medication. I wouldn't stack medicines because they all have different side effects unless you've talked to your doctor and they're specifically treating you for your child's allergies. But our own response to allergies can feel like a cold, that histamine response where we have sneezing and coughing and runny nose and congestion. But if you take an antihistamine like Zyrtec or Claritin, Benadryl for children, then it can improve their symptoms. If they have a cold, it's not going to drastically change their symptoms. So that is one sign. But then also allergies tend to go on, during a season, like spring.
Yeah.
Right. Okay. Next question here. What are some effective strategies for managing and preventing childhood obesity?
So we had the COVID pandemic, and we also know that we have, for the past, I guess 10 years really, there's been a lot of awareness about the obesity epidemic. And we've watched type 2 diabetes and obesity in adults migrate down to ages of even young children. And so it is something that is an important topic. It's an important topic to talk to your doctor about. But prevention is the most effective way to manage weight. We know that in lots of different studies that prevention is the best. So what does that mean? It means that, obviously if you are having a child, or you have young children, to be mindful of the things that contribute to obesity in children, and what are those? So in children, the most common reason that children gain weight or are overweight or obese is their diet and what they drink. So children tend to drink their calories. But that's hopeful in the sense that it doesn't take that much to manage that. Your kid may not like it, but really changing what they're drinking from sodas, juices have a lot of sugar, Gatorades, sugary drinks, that kind of all day, just taking that in can really contribute to weight gain. And then snacking. And kids snacking all day, they get school snacks, they get snacks at home, and then they don't eat the meal that's in front of them because they're full. That's normal. I would too. So those are some ways to manage weight, but there are some new guidelines and new recommendations from the American Academy of Pediatrics about medication management for children who are over the age of 12, talking to your doctor if that is something that your child is facing concerns of diabetes, that you talk to your doctor about. Maybe medicine is something that might be on the horizon.
Yeah.
Okay. Dr. Tom, thanks for your time. I appreciate it.
Yeah.
I always love these questions about kids because I always have so many.
Thank you.
Well, they're highly relatable, so I like that. All right, by the way, if you have questions for some of our doctors, you can reach us at Doc Talk. Just scan the QR code to submit those questions, and we'll take them to our experts.